what happens is that people, the public, wants to know the truth. You know, because what we're doing is out of the mainstream medicine, and the people are sick of prescriptions and sick of chemo and the traditional.
I'm going to break all this down for you. We have spent months thinking about this and really talking about this. We're here on the weekends talking about this. This morning we couldn't stop talking about this. These are my little chicken scratches.
I love it.
All of what it is that we do. So I'm just going to start, if you don't mind, and I'm going to break it all down, and then we can have a nice conversation about it, because I can't contain myself if I don't get it out.
You're excited.
Well,
passionate.
There's a process to have this conversation, right? You've got to reverse engineer this. All diseases, including aging, if you want to look at it as a disease, are a result of inflammation.
Right.
There are only two causes of inflammation, only two. They're pretty big buckets. There's either toxicity or infection, okay? The toxicity bucket is huge. It's metals, it's plastics, it's Wi-Fi, it's huge. There's all kinds of different toxicities. The infection bucket is huge. It's all the viruses that we've accumulated throughout our lives. It's root canals that are problematic. It's, there's all kinds of different infectious causes. But there's only two buckets, infection and toxicity. So what you look at is, if infection and toxicity are the root causes of age acceleration and disease acceleration, they cause epigenetic changes. We take these hits throughout our lives. Root causes of inflammation and immune system malfunction, right? So people don't understand when you say inflammation. Inflammation is an immune system response that can become dysfunctional. It changes the way the cells talk to each other. It changes the way the machine works. It creates autoimmunity, right? So the immune system basically is off the rail. You're now attacking yourself, your cells aren't signaling correctly, you cause inflammation or damage to the inside of the blood vessel, which then leads to the body wanting to create cholesterol, which leads to cardiovascular disease. All of it. I mean, it really truly is. Root cause, infection, toxicity causes inflammation, which manifests in all kinds of different ways. Genetically, we're vulnerable, so I look at it like a topography. Dr. Cintrone, if I pour inflammation on your genetic topography, it's going to manifest in this particular way. Dr. Ripoll, Stephanie, whatever. So we all have this vulnerability, if you will. As we go through life, those vulnerabilities change because of epigenetic hits. So it is our thought process that, and that's what we are taking our patients through. If you can identify and neutralize the toxicity and the infectious causes of inflammation, then you change the aging trajectory and the disease trajectory. Now with exosomes changed the game completely. So we were already thinking about this. We use UVBI and ozone and precision type IVs and various functional and integrative technologies to reverse those causes. But now with exosomes.
What are exosomes?
Exosomes, I'm so glad you asked. Okay. Exosomes are going to change medicine forever, okay? Mark my word, this is the biggest thing to ever happen. So we all talk about stem cells and the benefits of stem cells. And the benefits of stem cells are the exosomes that they secrete. Exosomes are the signals that the stem cells secrete to give direction to the cells around them. So if you take an old toxic person's stem cells and you put them back into the old toxic person, you're going to get old toxic signals. You're going to get old toxic exosomes. So you have very limited potential. If you're trying to heal a shoulder or a knee, that's easy stuff. You can even do that with platelet-rich plasma. That's not hard. But if you're truly trying to halt the aging process, reverse the aging process, change disease, you can't do it. We get exosomes from a placenta. Now you're taking signals from the very beginning of human life. the potential in those signals is all regenerative and healing. So you can imagine when you're born, if the wall is a wall of switches, they're all on. Your regenerative switch is on, your tumor suppressor genes are on, so you can fight cancers, your anti-inflammatory ability is on, your immune system is working beautifully, all those switches are on. As we age and we're toxic and we're infected, those switches go off, right? We can take those signals now and inject them into a human being, and into an adult rather, and it turns those switches back on.
And where do you inject them?
There's many places, so just an IV infusion. So I'm going to give you some anecdotal things. So these exosomes that we work with, okay, because you're only as good as the exosomes that you use also.
Right, exactly.
Just yesterday, we have evidence now that we have 1 billion exosomes per milliliter in our product, okay, and that's consistent. That's huge. You can't possibly harvest enough stem cells in an adult to get 1 billion exosomes. You can't possibly do it. And now we've got 5 billion exosomes in one vial, okay, in the freezer. What was your question?
From placentas?
Yeah, from placenta. Okay, so where do you put it? All right. So right now, we know the safety of this particular product. We know the placenta. We've tested it. It's free of cancers and viruses and everything else, and it's been used, that same placenta, for 4 years. Same placenta.
Do you only have one placenta?
Right, we're getting the second one in now. Okay, that's a beautiful thing because it's scalable and it's
So it's like they research the placenta to make sure that there's no genetic
That's
defects
exactly correct.
and all that.
We know that placenta inside and out. We then take the mesenchymal stem cells, which are pluripotent, from that placenta. We culture expand them in the lab, and then the intellectual property is how do you then get it to excrete the exosomes and then use it. Okay, so this product is FDA approved for the indication of wound healing. All right, so we know safety, we know all of that stuff. So everything else that we use it for is considered off-label, which we do all the time in medicine. All right. So
we cut that part.
No, that's that I want to make sure we say. This is an off-label use. Just like Botox is an off-label use if you use it anywhere from here. Just like all the medications we use all the time are off-label. It's perfectly fine. It's been tested for safety. Off-label means that we don't have any studies that show its effectiveness for this particular thing or that particular thing, other than the wound healing, okay? But I would want to say off-label. Transparency is very, very important. So what I'm going to tell you then, these stories that I'm going to tell you are all anecdotal. They're real, they're true, but they're anecdotal. Meaning we haven't done a double-blinded, study. Okay. There's a young man, his name is Chico Garcia. You can find Chico Garcia on Instagram. We can post his page. You can follow him. Chico Garcia, 7 years ago, had a boating accident, and he became quadriplegic. He had almost a total transection of C4.
Wow.
So no feeling, no movement, no sensory integration. He had all kinds of hypotensive episodes, on medication for that. It's a big deal, for 7 years. Probably 16 weeks ago now, okay, Chico Garcia was injected with this exosome product. He went up to New Jersey, worked with a Dr. Doug Spiegel, who did an intrathecal injection, so into the spinal fluid, and an IV injection of exosomes. Within days, Chico came off his medication called Midodrine, because there's communication happening now, within days. Within weeks, Chico started feeling sensation in his rectum and the genitalia. He started feeling some sensitivity, okay? At 60 days, 8 weeks, 60 days, you can see this on Instagram, Chico is moving. He's contracting his glutes, his hip flexors now. He's got some arm movement. He's sweating, okay? Now it's been 16 weeks. I don't know what he's doing right now. Hopefully he's posted. All right, so that's amazing. We have a gentleman here, Carlos, who's going to go on camera talk. Carlos has multiple sclerosis. Carlos, 6 years ago, walked into my office, and then he walked in with a cane, and then he walked in with a walker, and now he's been using a scooter for a long time. He's gone all over the world to try to effectively change his MS. he is toxic and infected, right? Just like everybody is. That's always the cause of disease, unless you have an accident like Chico.
Right.
Always the cause of disease, toxicity and so we are getting rid of his toxicity and his infection for sure. He's been seeing progress. Basically, he's been doing that over the last couple of years in various places, not just here. And he's basically seen the progression of his MS slow down, which is a beautiful thing.
Yeah, it's a big deal.
Exosomes changing the game. Okay, changing the game. So the best anybody could tell Carlos is we're probably going to be able to stop the progression of your MS if we can get to the toxicity and the infection. 4 weeks ago, Monday was 4 weeks, we did our first intranasal aspiration, I guess you would say, of exosomes and an IV infusion. Days, just Wednesday, we did it on a Monday, Wednesday, and I have it on video.
It goes right into the optical.
It goes right through the
olfactory.
cribriform plate, that's right.
It goes into the brain.
Exosomes are 100 nanometers small, so they cross the blood-brain barrier, okay? The delivery of exosomes, again, IV, intranasal, intramuscular, subcutaneous, intrathecal, there's all kinds of different ways of delivering it, depending upon what it is you're trying to do. 2 days after Carlos's first exosome intervention, he was graduated from his scooter to a walker, and he came here with the walker, okay? That same day, he was very excited, he actually walked out of here holding his wife's hand,
That's awesome.
which is huge, okay? Carlos is now, we've done 3 interventions with him. We're gonna give him some time now to let his body do what it needs to do. Carlos videoed over the Thanksgiving holiday himself in bed. Hardest thing, he's doing all of these complex movements without any spasticity. Now he's having some ups and downs, but he's headed in the right direction. But he's gone days now without any spasticity, where he's walking. He walked yesterday without any assistance at all. He walked out here without any assistance at all. Okay, so we're having our own experiences.
Awesome.
Dr. Spiegel will tell you that he's taken Parkinson's patients, and after 1 exosome infusion, a couple of months, they come in, with their walkers. A couple months later, they're running and catching a football. Okay. Took a young man who doesn't create sperm, azoospermia, which, by the way, Dr. Ripoll informed me, 1 in 3 young men now are infertile because of toxicity. 1 in 3. If you go to Glasgow, Scotland, it's 1 in 2 because of toxicity. Okay. This guy, 1 IV push of exosomes, and within 90 days was making 90 million sperm.
That's
Okay.
awesome.
So what this does is it decreases inflammation. It changes the inflammation almost immediately. All right. So while we're getting out the metals, and while we're getting rid of the infections and getting rid of the root canals and the sources of these particular problems, we're immediately putting a big bucket of water on the inflammation. And so the body starts to repair, normalize the immune system. You can reverse an autoimmune process if you look at the mechanism of action. It's turning on all those regenerative switches again, and your whole body's changing. So not only can we safely say that we can halt the aging process, but it is, I'm willing to make the leap and say that actually if you get rid of the toxicity, the infection, and you start turning those switches back on again, you really can reverse the disease process. And I have to be careful saying that, again, all anecdotal,
But we
no
see
study.
the patients, with infections in their gums.
That's right.
Infection causes inflammation, and the inflammation is an attempt of the body to block that attack, so everything gets swollen, so the bacteria gets limited, but the bacteria will eat the junction of the gum between the bone, and then you have massive infiltration of bacteria, viruses, parasites, and then it goes into the bloodstream, it goes to the heart, to the lungs, and then once you reverse that, within a couple of weeks you see that the patient has color in their face,
Everything changes.
their breath is fresh,
Yep.
It's like walking, it's an atomic bomb,
That's right.
you know. And then once you remove the metals and the actual heavy metals, you see changes.
The whole
You see
health of the human
changes.
changes.
We had a patient that his heart was working at 25%. And the moment we removed the inflammation, the root canals and the metals, his heart in 1 month went from 25% to 45% in the atrial
1
wall.
month, yeah.
So we see like changes immediately. The next day he was great when I met him. The next day when we removed everything, and he was 73 at the time, his color, he came with color on the face.
it
He
looks
was
different.
red.
Yeah.
You know, so you see something that is cyanotic, and then the person has oxygenation going to the brain.
The body has an amazing inherent ability to heal itself. With the exosomes and the removal of that burden, and with the exosomes now, it's ridiculous. You can just
That's really exciting.
make it exponential.
It's like reawakening the health,
Right,
the
that's right.
inherent
The
health.
body gets
That's right.
tired of fighting.
That's
The bucket is full.
You're actually reversing the epigenetic hits. You're
Absolutely.
reversing all of that stuff,
Yeah.
okay?
Because
You
the body
can-
is made to be healed.
That's
God made it
absolutely right.
perfectly. You know.
Absolutely.
It's self-healing. When you go to
That's right.
sleep, it heals.
There has been a situation where we,
So good.
very, very quickly here, taken people with chronic, with end-stage kidney failure, dialysis-dependent end-stage kidney, one infusion, IV infusion of exosome, 1 week later, they're urinating.
That's impressive.
It's
And I
very
think what it does is it also turns on your own stem cells. I think
That's right.
it's not like we lose all our stem cells, they're just dormant. They
They're
don't know
turned
what
off.
to do. It's like they're incommunicado. All of a sudden you give them these signals, and it's like all of a sudden they remember their own potential.
That's right.
And that's, I think, the fastest results that we see is reawakening our own system, and then we get the delayed
That's right.
continued improvement from turning everything on, et cetera, et cetera.
And you can't do that with your own stem cells
No.
because the signal's off.
Exactly.
Your own stem cells are going to
Exactly.
just give you more of what your potential is.
Yeah.
When you take these placental mesenchymal signals, which have
Exactly.
all of the regenerative potential, it's very simple. It's very, very simple. Now, the 26th of November, 2 days ago, 2 days ago, Taiwan, the National Center of Health in Taiwan, they published that they took mice, okay, they took mice, they created hippocampal damage, which would simulate Alzheimer's. That's what happens with Alzheimer's. They took 100% of the hippocampus and killed 80% of it. So they're down to 20% now. They infused exosomes, and these exosomes were not from placental. These were not even powerful exosomes. They took these exosomes. In 1 week, they saw neuronal activity, so a regrowth, a regeneration. In 4 weeks,
They were
60% of the hippocampus was restored.
That's
And they just published that 2
that's
days
very
ago.
impressive.
And they are all excited, as you can imagine, right?
Yeah.
So there's lots going on with exosomes. You're not gonna find this online. There's lots going on when you search exosomes. You're gonna find drug companies that are looking to manipulate exosomes to carry in chemotherapies and things like this. They're not thinking wellness and reversing
Right.
disease, because that's not what we do, right?
Right.
That's what we're thinking. That's what we're doing. So even before exosomes, just thinking about root cause and changing the trajectory is very exciting. But you add exosomes and it's amazing. And I know the struggle that you've had with trying to get rid of your metals and all of this.
Right.
The problem has been when you shake those metals loose with chelation, it causes this huge inflammatory pushback. So if we can infuse exosomes while we take you through that process, the exosomes have been shown to squash the inflammation. So the pro-inflammatory cytokines are well below threshold. The anti are well above, which is what you want, for up to a year after just one infusion. So if we took you on a quarterly basis and we infused exosomes while we are chelating, you're not, I don't believe, and Dr. Ripoll's expertise with opening up the removal, I don't believe that you're gonna be sick. I think you're gonna have an amazing turnaround. And all of the other consequences of this chronic toxic inflammation will start to be resolved also. So that's really the exciting.
That sounds
piece
really
of
good. Yeah. So the chelation part, that's doing chelators like EDTA and things like that?
We're going to use that. We're also going to use a lot of homeopathics to open the channels for the chelation to be effective. Vitamin C as well, and a combination. But I always make the analogy that if you have a very dirty room here and the walls are dirty and we just get buckets of water to clean it, but we don't open the door, all we're doing is moving the dirt from one place to another.
Right.
So the key to do this successfully, I mean, without the extra, just the very beginning is to open that door.
Well, the other
So
thing,
that's the liver.
that's right.
Well,
And the
that's the
kidney.
liver, that's the
Liver.
lymphatics,
That's right.
that's the
That's a
kidney.
lot of things.
There's so many different things.
The other thing though that you always forget because it's second nature for you, and I've learned recently is you have to get rid of the energetic memory of the metals as well. We see Carlos change big time when Tom treats Carlos with energetically erasing and
Cellular
neutralizing
memory.
that message. All of a sudden, Carlos will change.
Yeah.
So it's one thing to remove the substance,
Yeah.
but you have to also remove the memory, the electric memory of
Right.
the substance.
Yeah,
That's
yeah.
where the homeopathics
That's
come
right,
in,
that's
that's
right,
where the
that's right.
kinesiology, that's where a lot of the bio
Yeah,
impedance
there's
stuff
different
that we do.
levels. There's emotional, spiritual,
That's right.
Oh, yeah.
It's all,
mental.
that's right.
And we're
Let it
electrical
go,
beings.
my
We're,
electrical
we're
beings,
electrical
that's right.
beings, and we
That's
forget.
right.
Right.
It's like sometimes you have to, it's like the computer. It
Yeah.
all of a sudden it doesn't matter what you do, it's not working right. You turn it off, you turn it back on, and then it's
You
working
have to
great.
reset, yeah.
We have to reset. The
Yeah.
same with this.
So it's
Energetic
incredibly
reset.
comprehensive. I don't even like to use the word holistic because somehow that indicates that it's, less than, it's very technological. And
Yeah.
it's incredibly comprehensive
Yeah.
approach to how does the mechanism go off track to begin with? How do you get it back on track?
Yeah.
And then how do you then take it back in time
Yeah.
and really
And how your
exponentially?
genetics applies to it. It's like what you were saying, that beautiful analogy at the first. We can have the exact same mix,
Yeah.
but what will determine
That's
how it will show up, it may show
That's
up
right.
in you with migraines, with you it may be cancer, with you heart disease. It doesn't matter.
It's
The
the
is
same
the
problem.
same insult.
Yeah.
It's how we react to it. That's
That's right.
where our epigenetics and genetics come into place, and that's why understanding each person
Yeah.
is so critical.
So this is not academic,
No.
we're doing this now.
Yeah.
We're doing
this. And this is not hard either.
No, we've been doing it for
Because
a long time.
it's the same problem in everybody.
Yeah.
It's just,
Exactly.
it's really the same problem, and therefore, the solution is the same.
Yeah.
And that's what I love, and I have to go.
Ah!
We all have to go.